After I had my son about 8 years ago, my second child, I had noticed I started peeing a little bit every time I would sneeze or jump or run. And I'm a nurse and I work 12-hour shifts and it's embarrassing. But I know it's very common. I just don't understand. I've tried the Kegels and all those exercises. I've looked into all kinds of procedures. I don't know which ones are effective and which ones aren't. So.
Okay. Well, first of all, thank you for sharing your story because you're absolutely right. A lot of women are impacted by this. So, you know, this can really take an emotional toll on people. Has it impacted your marriage in any way?
Well, he doesn't really care, but I do.
Yeah. And you know, a lot of times people will kind of modify their daily behaviors based on the incontinence. So they may wear dark pants. They'll say, you know, they don't want to go certain places. They're always trying to figure out where the nearest bathroom will be. So in addition to the Kegels, have you tried changing your diet? Have you tried any other therapies at all?
Well, I eat pretty healthy and, you know, but I try to drink more water and sometimes that makes it even worse. Just the more I try to drink more water and then I have to pee more. So kind of counterproductive.
And this is so common after pregnancy. Those pelvic floor muscles can weaken. And so we're going to go with a little tag team approach because we have our gynecologist here, but we also have joining us via Skype, Dr. Aaron Spitz, who is a urologist who I know in your practice you deal a lot with these issues with incontinence. Dr. Spitz, you've been hearing Nicole's story. What are your thoughts?
Urinary incontinence is very common, particularly after childbirth, because the baby and the delivery itself puts such a strain and stretch on the pelvic floor. The pelvic floor is a hammock of muscles that hold up the vagina, the uterus, the bladder, and the urethra. And when they get stretched out, those things shift out of proper position. And now what can happen is the particular alignment that allowed the bladder to hold the urine, even when you jump, cough, laugh, strain, is now thrown out of kilter, and even slight movements can cause you to leak urine.
I'm curious because you mentioned trying the Kegel exercises, which are things people can do at home. How often will that be effective with someone who's having some of this urinary incontinence, say, after pregnancy?
You know, Kegel exercises can be very effective if the incontinence is mild to moderate, if they're started early and person sticks with it. But it really does take a lot of commitment, dedication. And some cases are just simply too severe. The change in the architecture is too much just to override with tightening up those muscles more. They actually have to be surgically lifted back up into an alignment. And although there are a number of other non-invasive techniques and procedures out there, some including vaginal laser rejuvenation, others including heating of the urethra, in a case like this one, I suspect that what really needs to be done is realign the pelvic floor, and that's going to be best done by a surgical approach, such as a sling, where a little hammock of either graft material or mesh or the patient's own tissue is brought underneath the urethra, cinched up, and now when the person coughs or strains, that pressure can't push everything down, and it stays nice and tight and keeps that urine where it should be in the bladder.
And Dr. Spitz, kind of going back to the Kegels, you're absolutely right. It works best if the symptoms are mild, not for someone who really needs a surgical procedure. But sometimes people aren't doing them right, and there's something called pelvic floor physical therapy, and that can also be beneficial for people because they can actually work with someone who helps them use the correct muscles to make sure they're doing the exercises effectively to get the maximum benefit.
Are there other common triggers like alcohol or other things people should avoid if they're experiencing incontinence?
For some people, foods. It could be tomatoes and tomato-based products for some, spicy foods for others. It can really vary. And then there can be a condition where your bladder is just at a baseline overactive. And sometimes it's the overactivity more than the muscle weakness that's actually causing the incontinence. A little physical jar then sets off a muscle squeeze of the bladder. And it's not because the pelvic floor is weak, it's because the bladder is overactive. But Nicole, what I'd like to do is extend our practice's services to you, and my partner, Dr. Leah Nakamura, who is a specialist in female incontinence, has agreed to see you, evaluate you, and find out what the best treatment would be for you, and then get you fixed up.
Thank you so much. Wow.